Hi, today we'll go over the process of taking blood pressure. First, there are some preliminary questions and instructions that you need to assess. You have to make sure that the person has been sitting quietly for at least 5 minutes preceding the measurement. You also have to make sure that the person has not ingested any nicotine or coffee in 30 minutes preceding the measurement. Otherwise, it will result in an inaccurate reading. Posture is a critical component in taking blood pressure. Her back has to be supported, her arm has to be resting supine at heart level, and her feet must be flat on the floor. And finally, you must place the cuff on the bare arm with the appropriate cuff size. That is the one that encircles 80% or more of the upper arm. This is a sphygmomanometer, which is composed of the inflatable cuff that has some labels on it. It also has attached a mercury manometer and a bulb. You also have to make sure that the valve in the bulb is closed, but not too tight. This is a stethoscope. You have to make sure that the prongs are not facing backwards, otherwise you won't hear anything. They have to be facing forward towards your nose. That way the prongs are directed to your ear canals. You have to make sure that the diaphragm valve is not closed. Release it, that way you can hear for the heartbeat. Once again, don't forget to place a cuff on the bare arm. You have to place it at least 2 inches above the artery. And you have to be able to stick at least 2 fingers in the cuff. Next, you're going to feel for the pulse and you'll place the diaphragm right on top of it, placing the fingers on the side of the diaphragm and ensuring that you can clearly see the mercury manometer. When you begin inflating the cuff, make sure that you bring it all the way to 200 millimeters of mercury. Then release the air with a rate of about 2 to 5 millimeters of mercury per second. The first carve sound that you will listen for will be your systolic measurement, and the second will be your diastolic measurement. Once you get your measurement, make sure you release all the air. My client's blood pressure is 118/70, which puts her in a normal classification. Here it is, a classification table with respect to your blood pressure.